Hello, my name is Antoine Giraud. I'm an associate professor of pediatrics at the Université Jean Monnet Saint-Étienne in Région Auvergne-Rhône-Alpes, France. In this podcast, I'm going to tell you the story behind our article recently published in Developmental Medicine and Child Neurology entitled Perinatal Inflammation, Exposure and Developmental Outcomes 7 years after neonatal arterial ischemic stroke. Neonatal arterial ischemic stroke, or NAIS, is the most common form of perinatal stroke. But even today, we still cannot propose any specific treatment for infants with NAIS because its pathophysiology remains poorly understood. We studied a French multicentric cohort to investigate the association between perinatal inflammation exposure and developmental outcomes after NAIS. To do so, we tested full-scale IQ at 7 years. Our hypothesis was that perinatal inflammation will be associated with lower IQ score because this exposure represents a neuronal injury and is associated with lower developmental abilities in both preterm and term children. But unexpectedly, we found the exact opposite. Perinatal inflammation exposure was, in fact, independently associated with an increase of the IQ score. After obtaining these counterintuitive results, we decided to dive deeper and analyze lesion volumes and distributions between exposed and unexposed children. And in the same way, we found that children exposed to perinatal inflammation had less extensive lesions compared to unexposed children. We were amazed to discover that, aside from differences in developmental outcomes, perinatal inflammation exposure also discriminated between two categories of NAIS with different lesion characteristics. After synthesizing these results with the current scientific literature, we propose that there is not one type of NAIS, but at least two, and that these two NAIS categories have distinct mechanistic pathways. A focal arteritis in children exposed to perinatal inflammation, and an embolism in children unexposed to perinatal inflammation. We believe that identifying these two NAIS categories will open the possibility for specific treatments in the future. For example, anti-inflammatory strategies may be appropriate for infants with arteritis-associated NAIS, whereas recanalization strategies would be preferable for infants with embolism-associated NAIS. We hope you will enjoy this research work. Please feel free to contact us if you have any question. Au revoir.